For the first part of the meeting today, we will sit as the Board of Health. And because of that, I'm going to turn it over to Dr. Travis Gales, who will begin our update. Dr. Gales, thank you for all that you are doing for Montgomery County.
Thank you, Council President Katz, and I want to extend that thank you to all of the individuals who are on the front line, who are doing the work across all the different government agencies, non-government agencies. As Dr. Stoddard and I are in front of the cameras a lot, but we really are just reflecting the hard work that lots of people are contributing right now to making sure that the county has a robust response and we meet the needs of our residents. So thank you to everyone out there, and thank you for the opportunity to provide this update. The first question I thought about is what's changed since March 3rd, since we last sat before you all and we talked about what we were doing to plan for this. This was the Tuesday before we were notified of our first cases on that Thursday evening. And what's changed is we've seen not only a significant increase in the number of cases in our jurisdiction, we've seen an increase in all of their cases across the country now in every state and different territories. And we've also seen the number of fatalities increase. And if you can recall back to that initial conversation, I laid out 4 criteria that we would use to judge and determine how we shaped our response. And that first one was if we saw an increase in the number of suspicious cases or people under investigation. We saw an increase in the number of actual cases across the country. If we saw a number of actual cases in our jurisdiction, a significant increase in those. If we saw a difference in terms of how cases were transmitted, because if you recall early on, transmission was related solely to travel history, and we know that that has changed now that we see evidence of community transmission across the country and even within our state and jurisdiction. And then the last component was looking at if there's any change in the severity of symptoms in terms of how the disease progresses in individuals. And we have seen changes in all of those, with the exception of the last case. We have not seen a significant departure from the clinical picture that has been presented across the country. Although EPI does suggest that we are seeing more younger folks impacted and seeing an increase in the number of cases in the under 65-year-old age group. So those are summary points in terms of what's changed since March 3rd. When we look at the total cases across the country, and I will caution that these numbers were pulled at 6:30 this morning, so they are likely to have changed since then. The total number of cases is over 33,000, probably upwards of 35,000 now, and total number of deaths I know actually is closer to 500. And again, we've seen cases in all of the states across the country, including West Virginia, who did not have a number of cases, but most likely that was due to lack of testing on a large scale, more so than anything else. When we look at transmission sources, travel related, again, these were the majority of the initial cases across the country, including those initial cases in our jurisdiction. Another 500 were related to close contacts to those original travel related cases. And then we have the lion's share of cases that are continuing to be under investigation. And I want to make sure that folks understand why. You say, well, why are there so many cases under investigation? One of the byproducts of significant increases in cases in a short amount of time is the lack of the ability to have the bandwidth to be able to do extensive contact investigations in a short period of time. So they simply take time. It also suggests, again, that there are a significant number of folks who are impacted by community transmission. And one of the things that, particularly as we shift to the next slide and look at our Maryland numbers, and these were pulled this morning. They've been updated to 349 total cases in the state and 107 cases in Montgomery County. 4 of these cases are pediatric cases. None of those cases are within Montgomery County, and there have been 3 COVID-related fatalities reported to date, one of which was a Montgomery County resident. But in having a conversation earlier with Councilmember Reimer, wanted to emphasize which number should we be looking at. So when I talked about, go back to this slide, the cases under investigation, community transmission, we know that community transmission is present, but based upon the testing algorithms that were in place for a significant portion of time, which were strictly related to travel, we don't have a true denominator of what the burden of the disease is within our population. And so what we're finding is certainly as more testing opportunities are made available to individuals and more folks are getting tested, we're seeing an increase in the number of positive results that are coming back. But also that recognizes that we're also seeing potential pockets of transmission popping up as well. I will say we are continuing to work on building an epi apparatus to be able to do predictive modeling that is based on our actual case count and not using models that are more generic. We're working with our partners in DC as well as Northern Virginia with some of the academic partners, including Georgetown and the University of Maryland, to build an apparatus that will be able to take in input of our positive cases and then be able to spit out geo-related maps as well as predictive models to showcase where we may be going to determine, dependent upon the level of restrictions we put in place in terms of public health actions. I will say this, at this point, a lot of the models in terms of predicting where we will be in terms of saying.
Excuse me, Dr. Gales, can you speak more into the mic?
Sure.
Thank you.
Sure. A lot of the predictive models that or the impact of the actions that we put into place will be seen over the course of the next week. So there won't be immediate changes in numbers right away to determine the true impact of the social distancing policies and the closures that have been implemented. And something that I want people to keep in mind is that even hopefully, this is in the near future, but I do predict that it will take some time when we start to see numbers plateau and decrease in terms of number of new cases. That does not mean we stop the restrictions or stop the social distancing policies we put into place because it will take some continued time to see the added benefit of those actions. Wanted to give an update in terms of testing prioritization. Testing capacity continues to be a significant issue. And let me say this very clearly, any frustrations that you all have related to testing capacity, I have them times 10. This is a significant issue. Since our last meeting, we have seen private labs be able to offer testing opportunities to folks. Individual institutions have developed their own testing apparatus and mechanisms to be able to analyze assays for their patients within their network, including Johns Hopkins for one. And there has been the introduction of a rapid test through the Cepheid Corporation that requires utilizing Cepheid machinery to be able to run those tests. But we want to make sure that people at home understand that the most up-to-date guidelines related to testing prioritization, giving the testing capacity that is present, are these populations here. And these include the most recent recommendations from the CDC, and emphasizing the point that we are not at point of demand testing for individuals who don't fall into these categories or demonstrate some level of symptoms. Before, again, back on March 3rd when I came before you, the testing algorithms were still tied to consulting with your local and state health department to have a conversation whether or not the test was warranted. Since private labs have come online, providers can order those tests on their own, following guidelines, though, in terms of recommendations for clinical presentations. Particularly for those individuals who have respiratory symptoms or symptoms concerning for COVID that cannot be explained by another diagnosis. Because I do also want to emphasize the point that everything that coughs and has a fever is not coronavirus. It is still tail end of flu season, it's allergy season, and there are a host of other conditions that can cause these symptoms that aren't necessarily COVID. So providers have been recommended and provided guidelines to make sure they do their due diligence in terms of ruling out those other potential diagnoses, many of which actually have other treatment modalities that can be effective in mitigating those symptoms. I will also add that some of the guidelines include recommendations for providers to provide counsel to their patients. And if individuals are experiencing mild to moderate symptoms, but have symptoms that are highly concerning for COVID-19, in some cases recommending those individuals that they stay at home, self-quarantine for a 14-day period, and do not come in for testing. And if their symptoms worsen, seeking medical treatment as appropriate to address those symptoms. Some of the logistical updates I want to provide in terms of some of the operational aspects. Our call center is fully staffed from 8 a.m. to 8 p.m. and we have experienced nursing staff providing on-call coverage overnight for calls that come in to 311 and need further triage. As I mentioned before, we've updated our contact tracing and investigation process. So when a positive case is sent in and provided to disease control, at minimum, there is an interview with the index case. And if the index case, for whatever reason, is not able to talk, for example, if their medical condition has rendered them unable to talk, we've done close follow-up with immediate family members and intimate contacts. The level where we have seen potential for large-scale exposures, we've been very transparent about that and announcing that, working to clearly identify individuals who may be at risk and may require a quarantine period. We recognize that anytime there's a report of a positive case, particularly tied to a specific employer, that will cause a lot of anxiety. What I want people to understand is that we very carefully and rigorously, through that interview process, identify individuals who, based upon the reports from multiple conversations, determine and assess if an individual truly is at risk based upon their level and quality of exposure. When that is the case, those individuals are identified, they are provided further guidance, and they are followed up accordingly. Testing capacity, I already commented on. I will say this, that there are efforts across the state, even in our local jurisdiction, to stand up mobile testing type venues. We've done a lot of planning to stand those up. Our limiting factor is testing capacity and kit availability. So we've mapped out a couple of different opportunities, and we are awaiting test kits to be able to stand those up. One, well, not tied to us, but the governor announced one effort that is being stood up in Prince George's County is a joint effort between the National Guard and the state to provide testing at FedEx Field. Again, very similar to us. The logistics are in place. We're waiting on the test kits to come to be able to provide those services. And also want to highlight some of the mitigation strategies that have been put into place. As you're aware, the hospitals have put up tents to do screening and triage outside of their emergency rooms. There's been significant, from the state level, service and business closures to mitigate contacts, as well as implementation of social distancing strategies such as those that we are doing right now in terms of limiting the number of folks in spaces and increasing distance amongst us, 6 feet, and particularly staying away from individuals who are demonstrating symptoms. And the last component, as I mentioned before, is we're working on building out more geomapping and modeling capabilities to be able to do real-time follow-up as well as predictive modeling to see what the impact of different strategies are on our interventions. So one of the last things I want to emphasize is that through this process, there's been significant collaboration. Our congressional delegation has been very active in terms of hosting town halls and opportunities for constituents to send in their questions and address their concerns. I've participated in 2 of such events with Congressman Trone's office and Congressman Raskin's office last night. We've had great partnership with our colleagues across all of the different government agencies, but wanted to highlight just some of the few: our school system, Department of Corrections, our first responders, our services to end and prevent homelessness working with the shelter community, and our safety net programs through Montgomery Cares clinical programs. The last thing I want to highlight is that in addition to working to build testing capacity and address the logistical things that I've mentioned before, is we are also working very hard on surge planning, recognizing that as numbers increase, there is the potential that we may have a significant burden on our hospital systems, including the emergency rooms and inpatient beds. We have surveyed all of the hospitals to assess the bed capacities, their intensive care capabilities, as well as access to ventilators. The hospitals are also working closely with our state colleagues to review and assess readiness and what the particular needs are in terms of supplies. And we are actually having a call tonight with the hospital CEOs to discuss further needs and how we as a local government can support them through that surge process. I will say at this point, we aren't currently experiencing a tremendous heavy burden on the resources, but we're not waiting for that to happen before we implement plans. And some of the other things that go into this are looking at alternative facilities to be able to increase bed space. The governor released an intention to create 6,000 beds across the state. We're looking at all of our facilities, our current facilities, how to maximize space there, how to reconfigure them to maximize space and capacity, as well as other facilities within the county that may be able to provide some of those services. That concludes the slides presentation that I have. I'd be happy to answer questions. I know Dr. Stoddard may have some additional thoughts to offer, and we'll be happy to answer any questions after that.
Thank you. For my colleagues who are not in the room, this becomes a little bit more difficult. There are people in the room, your colleagues who want to speak, and I'm going to call on them. If any of the colleagues who are not in the room has a question, please say your name and then the question after the three colleagues who have since asked to speak. And so with that, and anybody, I did want to make a note that everybody should have their microphones on mute unless they want to speak. But when you do speak, please remember to take your microphone off of mute so that there's times that people forget to do that. And of course, we can't have more than one person speaking at a time. So, and with that, we're going to ask Councilmember Jawando to speak, please.
Sure.
Before Councilmember Jawando, please, Dr. Stoddard.
Yeah, I only have a few things. I wanted to save time for questions. I thought that was more important. And I want to give a couple updates on some key things that we're working on right now. Resource acquisition is a big push within the county government side. Obviously, we've prioritized both cleaning supplies, personal protective equipment, and other key resources that we need during this time. Our Department of General Services, Office of Procurement, Emergency Management, Health and Human Services, working very closely together with our first responder entities to make sure that we are projecting what we'll need, but also acquiring whatever we can get our hands on, knowing that we can provide additional resources that we can acquire to our nonprofits, to our hospitals, to others who will need them. And so we're using county government as a vehicle to obtain these resources on behalf of our entire community. And so that's a big ongoing effort. You've seen tremendous changes in the way the executive branch is delivering services. I think you will continue to see that as we have opportunity to make changes or are making changes to do more telework, to do more teleservice delivery, to do additional options for either online or phone-based reporting. So you're going to see continual changes in county government where our services are being modified in a way that supports social distancing. And many of our non-essential services that can't be done via telework will be changed substantially or not delivered to protect and promote social distancing. Volunteer management, I want to talk about this because this is a really big thing. So our community has shown tremendous spirit in making donations, volunteering time, wanting to volunteer more resources. So I want to talk quickly about that. After, in 2016, we had our Arliss Street explosion and fire that really pushed us to develop a volunteer and donations management program in Montgomery County. And I will say that process that we went through after in 2016 is really paying off now. We have a community organizations active in disasters, what's known as our COAD, that is a volunteer network of our nonprofits, businesses, Boy Scouts, everything you can think of, who are coming together and working with the county side, both through our volunteer center and the Office of Community Partnerships, Emergency Management, Health and Human Services, to coordinate essentially a clearinghouse where resources are offered or resources are requested, and we can offer a clearinghouse process to get those in place. We've already heard people wanting to donate things like PPE. and we're happy to take those. Obviously, we'll try and match up the kind of PPE or kind of resource that's being offered with the appropriate place for it to be utilized. And so if you have those kinds of resources or have folks who are interested in donating those kinds of resources, we're happy to hear about them. Depending on what the nature of the resource is, we may want to take it immediately, or we may say, hey, we're going to put this in our catalog of items, and when that time comes, we'll be following up with you. And if there are people who want to reach out to us about that, emergency.management@montgomerycountymd.gov is a great place to reach out, and we're keeping track of all the resource requests that come in and all the resource offers that come in through that mechanism, and we'll make sure that we'll be following up with everyone that we hear from. Outreach has been a huge push. We have a lot of special populations, hard to reach, non-English speaking, hearing and visually impaired. Ken Hartman has been assigned as the point person for that effort. We've actually taken, I believe, 14 people from various places throughout government who are master level qualified to translate both written content but also verbally. And we've taken them out of their traditional job duties and have them assigned to be doing real-time translation of the guidance that's coming down from the state, guidance coming down from federal government, local guidance that we're producing to provide basically a constant translation service for the information that we have coming in. The last thing I want to highlight is we've gotten a lot of reports of people from the public reporting what they see as violations of social distancing orders, things like that. And in some cases, they are absolutely that is the case. We did have, an example I want to provide because I think it's really important. Is we had something posted on Facebook about a church that appeared to be having a large gathering based on the number of cars in the parking lot, and the content on that, the commentary on that was largely negatively directed towards that church. We went and did some investigation. It turns out the church was simply allowing their parking lot to be utilized by residents in the area who had, parking challenges. And so they weren't having a mass gathering, but it certainly appeared, and the things that they saw online made it look like that way. And so I think it's really important that people continue to report those things, but just be understanding that we'll investigate. And in not all cases, it's people ignoring social distancing. So try to reserve judgment until we all have the facts on any given situation. And so I think it's just really important. I want to provide that as a context comment. So with that, I'll just open it up to questions.
Thank you very much. Now we're going to hear from Councilmember Giwando, please.
Thank you, Council President, and thank you, Dr. Gales and Dr. Stoddard, and your teams, as you rightly mentioned, the many hundreds, thousands of people who are working hard to make sure that we do everything to keep our residents safe. When the federal government falls short, local government's got to step up, and you're doing that in a tough situation with not enough tests and limited resources. And so I think I speak for all my colleagues that whatever we can do, as we've been in constant communication, to continue to assist your efforts. We're going to take action on some very important legislation today to introduce it, to support folks. Please let us know, because you're doing a great job and people are scared. And when you have a fire and you have a crisis, you don't look at the water meter, you turn the spigot on full blast. and that's what we're all trying to do here in our context and work with our federal and state partners. So thank you for what you do. I did have two questions. I have heard from many seniors that have underlying health conditions that are, if they start displaying symptoms, are concerned about going out to get tested, even after consulting with their clinician. What is the best advice to those people, or anyone who might is afraid to go out because of an underlying condition to get tested? Are they still supposed to call their medical professional? And what would you advise that medical professional? I've also heard from medical professionals, primary care, that they're not necessarily sure. I know we've heard some questions about you can do self-swabbing and that can be sent out. Can you talk about those people who are in their homes, in senior facilities, or living independently, that might be concerned about going out to get tested because of their underlying condition?
Well, I think let me take a step back. So from a clinical perspective, the most important thing that people can do to protect themselves is to take care of themselves in general. So having a strong, healthy body is effective. If you do come into contact with it, it helps facilitate being able to fight the infection better. So doing the things you need to do to take care of yourself regardless. Now, when it comes to, seeking medical treatment, the proper advice I would give is to have them reach out to their medical provider, discuss their symptoms, discuss their concerns, and talk to the provider in terms of whether or not they recommend them coming out to get tested. If they do recommend that they come out to get tested, we would recommend that they follow the guidance in terms of limiting your exposure to folks. So potentially coordinating with the provider to say, I'm coming in at set time, at time X through an appointment, so that I know that when I get there, I'm minimizing my potential exposure to anyone in the office or things like that.
Well, let me just be more specific, because these are the cases I'm talking about are people who are metro access dependent, can't, would need assistance getting in and out of vehicles. If you're in that case and you call your medical provider and they're like, yes, we think you should get tested, is there support? What's the apparatus for someone to get from their home or where they're staying? Do you see what I'm saying?
So I know that folks are working on that in terms of the transportation level. I will say that there's two ranges within that. So the first range is going back to a point I made, is that there is a growing number of cases where providers are saying, if you are clinically stable, if your symptoms are mild and moderate, stay at home and self-quarantine. Now, should those symptoms worsen to the point you need an escalation of care, call 911 and utilizing the fire rescue service to be able to transport you to the emergency system. You have identified, yes, that is a significant donut issue there in terms of being able how to reach those folks. And so I think a combination of different strategies. If the individual is sick enough to where the provider is saying you really need to come in and be seen, then the conversation has to be, is that the time to utilize 911 so that they are able to be transported to an emergency room to be triaged and screened, versus if the symptoms are milder, being able to quarantine in place and manage from that perspective.
All right. That's very helpful. Thank you. And then it was great to see the surge capacity slide once we get tests and, and when numbers go up that we're planning that. I think people will be heartened to see that. The next question I had was related to the drive-through mobile testing, the kit availability. I know you said you're frustrated times 10, probably times 100, that we don't have the availability. It's good to know we have the plans in place. What's the latest that you can give us on what you're hearing from your perch as state-appointed health officer of when we're going to get more tests and the amount and the timeline for that? I know the best you can, and I know it's a moving target.
2 weeks ago.
Right.
I say that half jokingly, but that has been a constant refrain where we've been told, and this is not just us, the state as well, that more supplies are coming, and we've just not had them. And so what we've decided to do, and as evidenced by the National Guard moving forward and putting in preparations at FedEx Field. So the plan is to literally, when supplies are dropped off, let's say at BWI, we can stand these things up. So what we have looked at on a county level is looked at a host of different venues, from our Dennis Avenue site to some of our regional larger centers that have large parking garages that are enclosed spaces. We've looked at our school health centers as potential facilities. We've even had a conversation about utilizing some of the parking lot spaces at Montgomery College, since they're not being used right now, and have talked to the state about potentially utilizing our vehicle emissions centers as well as a potential site. So the answer is, we hope it's imminent. We're preparing as if it's imminent. That's as best as I can tell you.
Again, thank you for everything you're doing.
No problem.
Thank you, Councilmember Reamer.
Thank you. Thank you, Council President. I appreciated your comments at the beginning of the session. There's so much that I think we could all say if we wanted to speak everything that was really on our minds in this moment. It feels like such a historic moment, such a crisis unfolding in front of us. The comments that you made, Dr. Gales, that we don't know the burden of the disease in the community at this time. That is something that is just, it's such a frustration, and I know you share this frustration, but the fact that we are here on March 24th, months after this virus began its rampage in other parts of the world, and we still don't have a testing regime in place, is just a profound disaster. And we actually don't know. We are flying blind as far as the presence of the virus in the community. We just don't know. We're doing measures that, unfortunately, I think have been at times attuned to what the test results might show. But the test results are so narrow because they're only testing a small fraction of the population. And I personally feel that the CDC has been a lagging voice in this process, that the CDC's framework is more conservative than is really needed, and that the more aggressive decisions are ahead of the CDC. That's just my, and I don't need, I'm not asking for you to defend the CDC necessarily, but I just want to express that in general, is that I feel like the public health scientific side of this is somewhat behind the curve. The decisions to shut things down have been more aggressive than maybe the data at that moment shows, but then 2 days later the data catches up. And so it seems like that thinking has been evolving, and the stronger steps are proving to have been the wiser steps. And I think that's been educational for me and for everybody. And I thank Governor Hogan for being out there in front and making strong early decisions. And we still need to push the limit here. I can't help but say I'm so disturbed by the news that the president is considering, devolving this and making it a state by state or a local by local decision-making process about the response. Like, this necessitates a coherent national response. We've got to shut down travel. We have to command the production of the urgently needed supplies. We have to command the personnel that are needed. I was so compelled by China. They sent 40,000 healthcare workers into Wuhan. They shut down all travel. They sent 40,000 workers into Wuhan to meet the need. Nothing like that is happening in this country at all, and we are, as far as personnel, I haven't heard anyone say that we're going to be getting, medical personnel from parts of the country that are not yet impacted. It feels like we're sort of on our own in that moment. So generally, we don't know what storm we're in yet, but I see the news from this morning that New York has 25,000 cases now, and they're doubling every 3 days, and they're concerned that if that rate continues, they'll have 100,000 cases in 3 days, I suppose. So, we have to act now as though the virus is everywhere. And so we need our community to appreciate that every surface that you encounter when you're in public, you should consider that is, of danger, and act accordingly. But my specific concern now is around the beds. It doesn't appear that the federal state response in the states where it has gotten, that maybe we're 3 weeks away from being, has been satisfactory. That, they're still behind. I really want to urge the team, you, Dr. Gales, Dr. Stoddard, and everybody, like, no holds barred. Let's own our fate here. I don't know that we can rely upon the state or the federal government to provide the capacity that we need. The good news is funding that's coming available. The federal funding will be available, and hopefully we'll be able to reimburse for any expenditure that is worthy that we might undertake. But let's, a day that we spend now is one day more that we don't have the capacity when the crisis really hits, when there are thousands of people who need beds. And so, we've got to get ahead of this. I just wanted to repeat something that you said, Dr. Gales, that the tents are for screening and triage. The tents that we see going up generally. Remind me, what is the Army Corps of Engineers? What is their function here? They are planning out some of the surge capacity. Talk to me, please, about that.
So there's twofold, and I would like to comment on one of the points you made earlier.
Please.
So I put that in the parking lot. So remind me, my brain's not as well oiled today. But
I can't imagine. You've been working around the clock overtime for weeks, and I appreciate that very much.
No problem. The Army Corps of Engineer they are helpful in a number of capacities. So the thought is that they could be utilized to help doing large-scale testing. Venues such as the site that has been talked about at FedEx Field, and also being able to provide adjunct medical services to different healthcare providers. So helping construct facilities, helping set up mobile healthcare delivery spots in timely manners, and then being able to provide assistance in terms of workforce to be able to staff those types of centers and venues should they need to come online.
Do they report to you, to the state? Who do they?
They don't report to me. I think it's there's different levels. I think part of it is reporting to the state level because you've got your state National Guard and forgive me if I'm speaking wrong details, but they would report through the state and through the federal level in terms of that.
Okay. Thank you. I'll pass it on, but I just want to close with, again, I think we need to ensure that the capacity is there. We shouldn't rely upon even the Army Corps of Engineers if they're moving too slow. And the other thing that I saw that other jurisdictions have done, hiring thousands of people to be out in the community doing temperature checks, thermal readings. I think we need to be thinking about doing that, that we've got to look at those kinds of measures as well. Thank you.
Thank you. And I promise to be, I know brevity is very important here. I know that you all have things that you have to get to as well today. But I did, and I'm going to call on my other colleagues as well, and the colleagues who need to speak up if they want to be recognized. But I have gotten several emails about people that are not doing social distancing the right way, that they're going out in their neighborhoods, or going out to parks, or going out to various places. What else can we do? Any other thoughts on what else we can do to encourage people to stay at home, or if they are out, to do social distancing?
Well, I think we've pretty much, a lot of venues have been closed and shut down. There's, for example, like park spaces, we would encourage people to still, you can come outside. Like you can walk trails, you can do things for physical activity, but during those times, practice the concepts of social distancing. I think we've talked about limiting access to certain equipment in those areas. That's a conversation we had this morning, and we'll continue to discuss.
Yep.
And I think the first layer is putting up increased signage, and it may require being able to put up physical partitions to prevent people from utilizing spaces. And so those are things that we continue to discuss and are part of the repertoire that could be in our back pocket to curb that behavior.
Thank you.
I would like to
ahead,
add
please.
that by the end of the day today, in both the Maryland National Capital Park and Planning parks, as well as the county rec supported parks and playgrounds, there will be over 600 weatherproof signs telling people not to utilize pavilions, equipment, fields, basketball courts, etc. There was also a call between the law enforcement entities across the state and the governor's office yesterday. The expectation from the governor's office is that local law enforcement will be helping support the enforcement of these things in a much more visible, not heavy-handed in terms of issuing citations unless it's absolutely necessary, but certainly being out there in a multilingual capacity to make sure we're delivering the messaging that the parks are not intended to be places to play large sporting gatherings of any kind. I mean, we want people to be outside and getting exercise, because that's going to be important in maintaining, both mental health and our physical health. But also we have to do that in a manner consistent with social distancing practice. And I think you're going to see law enforcement taking a more overt role in doing that, as opposed to just responding to calls that may be made up reporting things. So they're going to be out there proactively doing more in the field.
Thank you. Next is going to be Councilmember Albornoz. One of the things that was just thought of, if the council members who are at home want to speak, so that I can put you in a queue, if you text me, I can perhaps get you in the queue as well. But next is Councilmember Albornoz.
Thank you, Mr. President, and thank both of you. I know you've been working round the clock. You have been extraordinarily responsive and have demonstrated outstanding leadership through an unprecedented time. All the tests and all the preparation to prepare us for moments like this have prepared us as best we can. And so we've been able to enact procedures for moments precise like this. And I think our local jurisdiction has been better prepared than many others because of that preparation and because of your leadership. And by extension, I want to also acknowledge and thank the entire Department of Health and Human Services, all the county agencies, especially our first responders. And the term first responder now casts a very wide net. Our first responders include our frontline medical staff, staffing our hospitals and our medical care facilities. Our frontline responders include the staff at our grocery stores and supermarkets and pharmacies. Our first responders are all of us right now, because we all in our county have a role to play to ensure our own health and wellness and that of our families and neighbors, but our entire community. And it's times like this where you realize that our spirit has been tested, but I have been so impressed at the outstanding leadership of our private sector as well, who has come forward in offering their assistance and help. When the federal government stubs its toe, local jurisdictions limp. And the federal government has done much more, unfortunately, than stub its toe. The mixed messages and the incredible frustration and the delay in the implementation of much necessary strategies have left all of us in a weakened position. And so I want to acknowledge that you are feeling the brunt of that, and want to underscore and appreciate and respect the frustration you're feeling with that response, but let our communities know that we're doing everything humanly possible to overcome what has been challenges that should have been addressed earlier, but that we are working through right now. So I did have a few questions and comments based both on constituent requests that have come in, and all of us are fielding just numerous constituent requests and feeling the frustration of our community and the exasperation and the anxiety that everybody's feeling right now, especially because we don't know exactly when this will phase out and when we will be able to move forward with business entirely as usual. But my first question does relate to testing. I don't want to reiterate what was said before, but as more tests become available, clearly the first wave needs to go to those patients who are the most at risk, and then as we extend that out. But as tests become available, are we prioritizing those first responders in addition to our traditional first responders, fire and rescue and law enforcement, but also medical personnel, nonprofit organizations, and those people who, by virtue of their work, are essential and must continue to interact, especially with vulnerable populations?
So the short answer is yes, but it's consistent within the criteria that have been laid out, is making sure that individuals, particularly those who are ill and have demonstrated symptoms, are tested first. And so hopefully we may get to the point where we are at just general testing for the general population. I think that in the absence of testing, there are a number of good strategies in place to make sure that we minimize risk of exposure to frontline, however you define it. So, for example, there are specific algorithms in place if you are a healthcare provider who is exposed to an individual who is confirmed case or highly suspicious and pending test results. So there's different strategies put in place to address a lot of those different situations. I think the ability to be able to expand that testing to individuals who are asymptomatic and don't have a known exposure is in large part driven by the ultimate capacity that we have once we scale things up.
Thank you.
I would only add that, and I agree with everything you said about the testing, and we feel like we're fighting in the dark on a lot of those things. I did not expect to be thinking about whether we consider things like non-FDA approved testing capabilities and other things like that, but that's where we're at.
Wow.
We're having those conversations because we've been We've been, hey, it'll come tomorrow, for 2 weeks. And so we did not ever envision ourselves as being in this kind of situation where we would be looking at things like that, tests that are approved in other countries but not in the United States. We are considering all those options because we agree that we would be much more capable of responding to this event if we had much better testing capabilities. Now, obviously, we've got to, we are essentially having to do some of the data analysis ourselves, the role the FDA should be playing to make these decisions. And we're in some really strange times as far as that goes. But I mean, I hear directly from first responders on a regular basis. We're working closely with them, and we agree that all the things you raised we agree with. Obviously right now, the first test will go towards where there will be a clinical difference in us testing you positive or negative. That's really the key. Where there's a decision where there would be, life and death is decided by whether we test somebody. But certainly, take an example. So if we have to take, we did have a law enforcement officer who did confirm positive, and then have a number of people quarantined. As a result of that, if I could test those people a week or 10 days in and clear them and get them back in service sooner, that's a benefit to our first responder community, obviously. But using a test to do that right now when there are people who are clinically very ill and need that test more is not something we can strategically do, and it would not make good sense for us to do that. I would like to get to that place where we could do some testing and clear our first responders, give them the peace of mind with their families, all of those things. We've certainly talked a lot about how we would do that once we have kits available, but until we have something that we can rely on, we can't implement something like that.
I appreciate that. And obviously, as they become available, we'll prioritize the groups that need them most, but wanted to get that out because we've been getting lots of questions from those organizations. Second, I know the coordination with the state is critical. I couldn't help but notice that the test sites did not include Montgomery County, although we have the most number of cases and the largest population. And let me just say for the public at large, we have over 130,000 residents that are over the age of 65 in Montgomery County. So as we talk about things like surge capacity and 167 ventilators available to the entire county, clearly there needs to be coordination in terms of prioritization. I know that we are working closely with our colleagues at the state level, and we have to continue that strong relationship. And I know from past calls we have indicated that we would certainly appreciate being a location. But if you could comment as much as you can on what those deliberations and discussions have been like with the state, and is there more that we need to do to reinforce that Montgomery County also needs a large capacity test facility as well?
So I can speak from the testing capacity and the public health capacity. So the things that you just mentioned those messages have been relayed to Baltimore and to Annapolis, and we've engaged in strategies to how to improve the testing capacity here. And as a result of those conversations, that's where we're talking about potentially utilizing our emission centers as spaces. So that was heard very clearly. And I am hopeful that the future conversations will take that into consideration.
I would only add that a couple things. Our colleagues at the state are working very hard too, and I think I want to make sure that's well recognized. They're making a lot of hard choices and decisions. And generally speaking, I've had a very close collaboration with my counterpart at the state for emergency management. I texted him today; he texted me back. They've been very communicative about what the realities they're facing. Now, there are certainly cases where we would like them to take more aggressive action. Surge is probably one of those. They put together a task force to look at surge at a time when I thought a task force did not lend itself to a task force model, and they need to be more aggressive in doing things, even if it meant we were going to. We always want more information to make the best decisions, but sometimes you have to act absent the most concrete information available. That you have to act with what you have in front of you, because the delay in not acting is worse than the misallocation of resources that you may face. And so I would certainly agree with the sentiment that we have to work with the state to the extent that we can, but we have to be willing to move beyond where the state is in a timely manner to protect our residents.
And we're definitely there. I mean, the surge planning is evidence of that, and we're not. The definition of insanity is doing the same thing over and over again, expecting different outcome. waiting for the feds to step up. That they're just not. So we're not waiting for that to happen, and we're being very strategic and thoughtful, though, about how we can work with the state to get those resources. And I remain optimistic because, as Earl pointed out, they're working really hard. They've been very transparent with us in the relationship and talking, and hopefully that produces some results shortly.
And Dr. Haft from the state is planning to be on our call today with the hospital CEOs, I believe.
He won't be able to make it, but he's part of the conversation.
Okay, good. Okay. So we've certainly reached, we don't want to have a conversation absent the state, but if the state's not moving forward in a way that we think is responsible to our residents, we have to move forward without them.
Thank you. Another population we've received messages from that feels on some level left out, would like some specialized level of communication is our disability community, particularly as it relates to testing. To Councilmember Jawando's point earlier, we have certain populations that are just less mobile. And so as we develop plans, if we could more clearly articulate those through our Commission for the People with Disabilities and other channels, that is a message that I was asked to deliver, and an important one, clearly. And likewise, I appreciate the administration's efforts recently to ramp up and be more strategic in the way that we're reaching multicultural populations. And I certainly have seen improvement. But that remains something that we need to do even better. There was a press release that went out yesterday in Spanish that had a number of grammatical errors, and there are also still phone numbers being publicized and promoted in multilingual communities, but that don't have the infrastructure for multilingual responses. And so if we promote a number, we have to double and triple check that that number is available, or at least has a plan to be able to, in real time, respond to the questions of residents. And we're going to continue to push for that, and we'll talk offline about some future strategies moving forward that I've spoken to Councilmember Navarro about. And I guess, the next wave of this discussion is going to be the surge capacity, as we've alluded to earlier. And so I will be following up both as chair of HHS, but also in general about the capacity of hospitals moving forward. The governor of New York this morning was profound and articulate in just letting the entire country know that they are the canary in the coal mine, that what is happening to them is likely going to happen to the rest of the country. And so just like Italy. And so I think that, to the degree to which we can be more proactive in that space, and the council stands ready to appropriate funds as necessary and to be able to move this forward, because as Councilmember Reamer said, we cannot wait. Thank you both very much.
Thank you.
Thank you, Councilmember Navarro.
Hello, can you hear me?
Yes.
We can.
Okay, thank you so much. Really appreciate it, Council President. Well, Dr. Stoddard and Dr. Gales, first of all, my appreciation, and I know the appreciation of our community for everything that you are doing under very difficult circumstances. I think that a lot has been done, and I appreciate also the work of my colleagues and departments, agencies. The leadership that has been shown, I think, has been tremendous, and I feel very, very good about that. I do have a couple of questions. Of course, some of these things have been mentioned already, but I think it's important to overall, and I guess Dr. Gales and Dr. Stoddard can chime in, of course. I guess it's a tag team, but there's a lot of concern regarding yesterday's announcement by the president. We are trying to get everybody on the same page, understanding that social distancing and some of these stricter measures are so important. The flattening of the curve as it keeps trending, it's really critical. And so to what extent will you be continuing to reinforce that message in light of what's being now said by the president that we should reopen America and that we should go ahead and in a week go back to what we were doing before? I think it's important for us to make sure that we have locally, and I guess hopefully statewide and throughout our jurisdictions, a unified message about why it is important to continue to practice social distancing, so that we don't see the same kind of surge of cases that we've seen in other countries. Do you have anything that you could share with us regarding that?
Sure, I'd be happy to. I think when we talked on the 3rd, I said that I wouldn't make any editorial comments, but I will suspend that now. What the president is saying is recklessly irresponsible. It is not based upon fact, and quite frankly, it's disgusting. It does not have a place in public health, and it undermines our messages that we're putting out to keep people safe. Any message that will come out of public health services from Montgomery County, from the health officer's perspective, will emphasize social distancing. In fact, one of the strategies that we have put into place is in any of our press releases, the leading bullet points in terms of prevention measures are social distancing, limiting contact with others, and staying home, followed by washing hands and those kinds of things to emphasize that message further. And other strategies that we have recognized, so all of the health officers in the DMV region had a call on Sunday to discuss, because quite frankly, the president's comments yesterday are consistent with a pattern of behavior. Those comments weren't new. And so we discussed how we can have unified messaging, and we will have another call tomorrow to discuss utilizing the COG space, the Metropolitan Washington Council of Governments, to be able to craft language that we can all use that gives one voice to all of the DMV regional health officers. In addition, I'm missing the call today actually with the state folks, but we have talked about creating similar language and a unified voice because we recognize that politics has no place in this. And in order to get people healthy, outcomes aren't red issues, blue issues, or whatever, however you want to couch it. And it's important that we have the space to continue to put forward those messages. And I'll make a promise to you here, as long as I'm in the role as health officer as Montgomery County, is I will continue to stand by that. And will be an adamant proponent of those messages. And I will say this half jokingly, but seriously as well. We also recognize that members who are speaking the truth have had their opportunities curtailed in many ways. I think Dr. Fauci was not invited to the press conference yesterday. But Dr. Fauci is a Montgomery County resident, I believe. And if Dr. Fauci is listening, I want him to understand that he is welcome in any of our spaces to talk about his issues, his thoughts, his views. We'd be happy to host him and happy to have a conversation with him and happy to make sure that if he is not afforded the venue and space to do that in his current role, we're happy to facilitate that here in Montgomery County.
Dr. Gales, I really thank you for that very strong message. I cannot emphasize enough to my colleagues and to the public that this is the moment where we have to absolutely heed the advice of our health officers. And I'm glad you mentioned Dr. Fauci because he is somebody that I think it's very clear many people are looking at him for advice and find that his very straightforward, scientific-based advice has been the best thing that we've had. I think it's important for us here in Montgomery County to send a very strong message that we put health over the economy, that we understand that we're going to do everything possible to mitigate the impact to our economy, but there will not be an economy if we have this rampant global pandemic decimate our county. And so it is so counterintuitive that I really wanted to point it out. In addition to that, I know there was already conversation about the surge that we are going to need regarding hospital beds and equipment and things of that nature. So I appreciate everyone who's working on those issues. Those are questions that I know people are having and concerns that are out there. I will also say that, the more that we can stay in touch to troubleshoot issues that may be happening in the community, things like, parking enforcement and things of that nature, I think that we need to definitely continue to troubleshoot in real time because there's just a lot of impact to our small businesses and communities out there. And lastly, again, I want to reemphasize such an important need for us to focus on quality communication with those communities that tend to be a little bit more isolated, non-English dominant communities that are hungry for information. A lot of times we will receive questions from people to say, well, what do I do if I have symptoms? And we say, well, first check with your primary physician, but what if they don't have one? I mean, these are things that we have to continually emphasize. And although, as Councilmember Albornoz said, we have made some inroads, I think, in the multicultural communication, the quality control continues to be a challenge. We really don't have a lot of time to plan for these things. So we need to continue to put that up front, because the more that our communities, the more that everybody understands the unified message, the better off we're going to be addressing this public health emergency. With that, I just, again, want to thank you very much for everything that you are doing, as well as our staff, frontline folks, our healthcare frontline people, everybody who's doing such an amazing job right now. Just thank you. Thank you so much.
Thank you. Dr. Gales, let us all say very clearly that we sincerely appreciate everything that you're doing. We sincerely appreciate your candor, and there will be never a time that you should not speak the truth. We need to hear it, and in fact, many other people beyond our county need to hear it. And so we thank you and all of your colleagues. And with that, I'm going to ask Councilmember Rice to please join us.
Well, thank you very much, Mr. President, and thank you, Dr. Gales, and thank you also, Dr. Stoddard. I really just want to start off by saying that you've been a great partner with us, especially when it comes to my role as being an intermediary and working with Montgomery County Public Schools and ensuring that we have the meals that are necessary for our children and families that need them the most. And we'll tell you that part of my concern still remains around the fact that some of those frontline folks who are working in delivering those meals don't have the necessary protective gear that a lot of other people in forward-facing folks do now. But there's a lot of confusion about whether or not that gear is necessary, if folks need to have the gloves and masks as they distribute food to our children. So for our public that's watching, as Councilmember Duando always says, for the millions that are watching at home, can you enlighten us on what some of the best practices are for those folks who are out there volunteering, those students who are going to people's homes and helping seniors in terms of grocery shopping for them? What should they be doing? What should they be wearing? What should the practices be for all of those folks who are still interacting with folks in our community because they're needed at this point in terms of their capacity?
Thank you, Councilmember Rice, for the question. The level of protective gear is determined by your type of exposure that you have. So when we're talking about PPE, personal protective equipment, what we're referring to is the level of stuff you have to put on to keep you from getting anything based upon the level of your interaction. So you can imagine, as a healthcare provider who's taking care of an individual who is a confirmed diagnosis, you're either collecting a specimen or you're having close contact with that person, you're going to need full PPE, which is some type of mask, an N95 or a surgical face mask with gown and gloves. That's due to the fact that you're having very close contact being defined as you are in close proximity from a physical level, as well as you're in proximity with that person for an extended period of time. It's not a transactional, very quick episode. And you're coming into very close contact with the person, which increases your risk of coming into contact with droplets if they're coughing, if they're sneezing. One of the other things that you would do, regardless of the level of PPE that you are wearing, is even when you take that off, one of the first things you're going to do is wash your hands. So even if you do have on gloves, you're going to wash your hands. And that's a common theme that permeates regardless of the level of interaction you have with someone. So I use that as a level of comparison to level set folks' expectations in terms of the type of exposures that would require a higher level of PPE. One of the things that in terms of when folks are volunteering, for example, every situation is different. But let's say you're volunteering and you're dropping off groceries at an individual's home. first of all, we thank everybody in the community who's providing those services because it's a godsend. It's a wonderful thing, and we thank you. And so to mitigate your risk is, again, continuing to wash your hands. It's a good idea for those seniors who are on the receiving end of those services to create some platform where, for example, the groceries can be delivered at the door, where they don't have to necessarily come into direct contact with the individuals who are dropping off the provisions and resources to them. That minimizes their risk of exposure as well as yours. And then again, practicing hand hygiene in terms of washing after you're coming into contact with different packages. For those who are in front-facing positions, there has been one of the benefits that has come from the federal level is putting out language related to the value of wearing masks. That is something that I will give them kudos on, is the fact that they did put out clear language in terms of talking about the greatest efficacy and value and benefit for those wearing masks are for individuals who are symptomatic and displaying symptoms. They should be wearing masks because that prevents them and helps mitigate them from spreading to others. But the utility for those who are otherwise healthy, not coming into or having extended contact with individuals, there's really actually very little public health value from that. And so in terms of, dropping off food, we understand folks' anxiety around it, but in terms of being able to, for example, come to a car and deliver food to folks in that enclosed setting carries minimal risk. And so would not necessarily qualify for an extended level of personal protective equipment. And even I want to make sure that folks understand, even in wearing gloves. You think about it, if you've got on gloves and you're coming into contact with different surfaces, you're still coming into contact with those surfaces. And so think about it, when you're taking off those gloves, your hands may come into contact with that. So even if you're wearing gloves, what I'm going to recommend you do is wash your hands.
With the gloves on?
Actually taking the gloves off, washing your hands after you've taken the gloves off and disposed of them. Because again, you're cutting off on your risk of exposure to whatever those gloves have come into contact with. So it's a long answer, but I wanted to level set in terms of the different levels that would require different levels of PPE and why we make those determinations. Again, it's based in terms of the quality, the length, and type of exposure you have with an individual. Coming into contact with someone does not necessarily qualify as a contact or a close exposure that we would be worried about transmission of COVID or any other illness for that purpose.
Dr. Gales, I really want to say thank you. That's an incredibly thorough answer and really is something that I think is helpful for our community as a whole. I did want to ask one last question. As a person who represents our agricultural reserve and a lot of our farmers, there have been a lot of questions around farmer markets. As we know that people still want to be connected to food, but then also around the concept of not having people crowded together. Folks are not sure if farms and farmers markets fall into the category of non-essential. And so from that perspective, can you give us a little insight in terms of our farms, our vineyards, things of that nature that are out there that are providing food for our residents?
Well, I think we have to, continue to follow the practices that, have been put into place. So, for example, from my perspective, I see farmers markets as venues for folks to get food. And people do rely on those spaces to get food, much like they utilize the grocery store spaces. So my preference would be to allow those to continue as long as there are mechanisms put into place to limit the number of folks around in a particular time, make sure that social distancing is observed. For example, I get excited, I don't get excited to grocery shop, but when I grocery shop in the different grocery stores I've been in the last week, I've noticed that they have put in partitions to make sure that people keep a safe distance from one another in terms of while they're standing in line and moving around the facility. So I would say my preference would be to, since there are a lot of people who do utilize those markets for food, and is a meaningful way for them to get those services, my preference would be to do what we can to keep them in place, but certainly making sure that the necessary precautions are put into place in terms of social distancing protocols to minimize transmission.
Thank you very much.
Thank you. Next is Evan. Councilmember Glass, please.
I go by Evan too. Thank you, Mr. President.
I knew you do. I knew you knew who it was. Yeah, thank you.
Thank you for this update. Most of the questions have been asked, but so I will tailor my comments to my role as the lead for homelessness in vulnerable communities. And every day I'm speaking with providers who, as of a week or 2 weeks ago, did not have a lot of the cleaning supplies and equipment to make sure that their facilities were safe, to make sure that their clients were safe, and to make sure that their staff were safe. And I know that the county has come in and helped provide some supplies towards that goal. But as more and more people are getting sick, there are greater concerns. And so, Dr. Gales, can you talk with us about how our most vulnerable communities, those who are experiencing homelessness and who are in shelters, how we are working to make sure that they're safe and the staff and the general community there? How are we doing in that regard?
Sure. We've worked very closely providing guidance with our HHS colleagues in Services to End and Prevent Homelessness, who have been working very closely with shelter leadership in terms of providing guidance, general practices in terms of how to implement social distancing in those spaces, discussing protocols in terms of identifying individuals who are symptomatic, determining and triaging those situations to determine if they need a higher level of care, and helping facilitate those individuals getting the services that they need to address their immediate situations. There have been discussions in terms of how to set up potentially if an individual utilizing the shelter space were to test positive, discussing how we could potentially shelter them in other spaces and provide quarantine for them should they need it, and any other individuals who may have come into contact with them. I would defer to Dr. Stoddard to talk more about the delivery of the different supplies, because I know that has been something that they have been actively engaged in and meeting the needs. I know that we've received a couple of emails at times from folks saying we're running short on supplies. We've encouraged them to give a timely heads up before the supplies are gone, so that we can discuss some strategies to be able to address their needs. Dr. Stoddard.
Yeah, so our Department of General Services is maintaining the supply that's going to be, that is routinely pushed out. We have updates almost every day about supplies that are coming in, supplies that are coming out. I'll make sure that we're prioritizing our homeless shelters. Absolutely. I would add two things. So right now, one of the plans that the Services to End and Prevent Homelessness is looking at is actually extending our current shelters to operate in multiple locations concurrently to allow for increased social distancing for the homeless population, and obviously to reduce the risk that a single, if one of our vulnerable populations were to get infected, you wouldn't expose the entire homeless population simultaneously, so you defray everything across multiple locations. That's actually being worked on with our Department of Recreations, and rec staff will actually potentially be supporting that. In addition, we're looking at catering those locations to make sure that we can replicate the services that are offered through our traditional homeless shelters in any venue that we're going to do those in. So I think you're going to see more news about at least 2 other locations where we're going to use for seasonal care. We've obviously extended from the end of March to at least the end of April. I would anticipate that being extended further, but we'll make that decision in mid-April or so. So there will be additional locations coming online that allow for more social distancing amongst our homeless population. And obviously, Dr. Gales alluded to other things about locations where we can either quarantine and or isolate members of the homeless population should they become infected.
Well, I appreciate that, and I just want to follow up with Dr. Gales on that regard for the individuals who are deemed necessary to quarantine, whether they are, at the men's shelter, now at Taft Court, whether they're at Progress Place, regardless of where they are, what is the plan to get them out of that population and get them into a speedy recovery?
So I think it would depend on the individual circumstance. I mean, we could talk more offline about the details, but the thought would be dependent upon the level of exposure and the depth of how many contacts there might be in that situation would determine, the next steps. We have identified a number of potential spaces to be able to do that. And so I think we are prepared for that. And again, I think the level of that response would be necessitated by the subsequent contact investigation to determine whom else may be in the shelter who may have been, who would be considered to be a high-risk exposure and need to be quarantined as well.
Okay, I appreciate that, and we'll follow up after this call. Thank you.
Thank you. Next is Councilmember Friedson.
Thank you very much for that. Thank you to all the colleagues. Thank you to the staff for figuring out a way to make this briefing and this meeting work while following the social distancing guidelines. I think it's important that we lead in what we're asking residents to do. So I just want to thank you for that. And Dr. Gales, Dr. Stoddard, I just want to thank you for your calm, your candor, your competence, your professionalism. It really has been an amazing tribute to the type of talent and leadership that we have in the county. And at a time of crisis, it's needed more than ever. And I just really wanted to appreciate this. This is a time for us to follow the lead of our public health experts and for politicians like us to be doing everything that we can to support you and the work that you need to do to keep our residents safe. That's true at the county level. It's true for the country. And some comments were made earlier, which I would associate myself with. But I just think it's important to note that. And we need residents to follow the lead of our public health experts as well. And so that's, I think, incumbent upon us as leaders in the community to really show that we are following your lead and following what you are telling us we need to do in order to make sure that we are staying safe and that we're keeping our residents safe, and understanding that all of us could be carrying this, and some of us are more at risk and more vulnerable than others, and we should be treating this challenge with that type of thought. I share all the colleagues' comments. I will reduce my comments and questions significantly, recognizing the fact that you've already missed a state call, that we're in the midst of a crisis, that you need to get back to the work that you are doing. But on the surge capacity issue, the availability of testing, the fact that we need, for Montgomery County, the largest jurisdiction and the place with the most number of cases in the state, to be treated accordingly. And we'll continue to support you in your efforts to do that, and are here to support you. I just had a couple quick questions on how residents who keep reaching out can help. One is we're getting requests from faith-based organizations in particular that want to be part of the solution to the challenge, and wanted to know whether it would be appropriate for them to continue or to start hosting blood drives or other mechanisms for that. It's the challenge of whether there's enough blood, which we've heard in the hospitals and the surge there, but not wanting to create a gathering. And I just was hoping you could provide some guidance for a number of faith-based institutions that have raised that issue and are torn between whether they would be helping or hurting in terms of the public health response.
Well, they would be helping, and we can figure out the logistics how to make that happen. So if there are folks out there who want to make donations or put together efforts such as that, we applaud that and support that, and will help facilitate to figure out the logistics how to do that. I will say there are a lot of efforts that are ongoing already. And I know that the county has, the Office of Community Partnerships is serving as kind of our central point for volunteers, and has a host of different opportunities that are already in place for folks to be able to look at and access and figure out how they can help. But beyond that, I think if there are other venues, folks can submit those ideas, and we can triage them and figure out who they need to get connected to figure out the logistics.
Right, but it would be appropriate for faith-based institutions to be reaching out to the Red Cross currently to set up a remote blood drive and follow the protocols that the Red Cross provides them. That would be consistent with the county's. Okay.
There's absolutely an imminent blood shortage nationally that we are definitely encouraging people to continue to donate blood. There's no additional risk associated with donation of blood if it's done in a manner consistent with good Red Cross practice. They follow FDA guidance for how to do blood collection, and there's no there's no additional risk associated with that during this.
Terrific. I just wanted to clarify that because it's been a frequent question that we've gotten. And then we have a lot of residents who want to help the healthcare heroes that are on the front lines of this and our first responders who are addressing that. Are there particular things that we are looking for that we should provide guidance to them in terms of donating food or finding other ways to support them besides the number one way you can support them, which is to stay home?
Don't forget, wash your hands. That's
Wash your
important
hands.
as well.
Stay home and wash your hands.
Yeah, so I know of already a couple. I think Mission Barbecue did lunches for all the firehouses today, and we appreciate that donation. I would just encourage people to not do. I don't want to. We're trying to keep our firehouses secure at the same time. So we've actually stopped doing a lot of non-essential work in the firehouses because we want to protect our first responders from any additional opportunities for exposure. So if they're interested in donating, we would recommend that they reach out to the fire department first to make that donation rather than just show up at a firehouse. I mean, the firehouses are open still for people who are in need who come to them, but just when we're volunteering, we're trying to make it more efficient. As far as on our COVID-19 webpage, there's a section dedicated to volunteerism and donations, and we encourage people to visit that if they want to make resources available, because we'll absolutely match up whether it's coming to first responders or within the public, or one nonprofit to another even. We can facilitate that through that mechanism there. We appreciate donations coming in to our first responders. We also recognize there is a tremendous need within our community that goes beyond even our first responders. As Councilmember Albanaz referenced, we have first responders in a lot of places that we don't normally have them. So I certainly think, I'm not speaking out of turn to say our first responders absolutely appreciate the community support for them, but just recognize that there are other people who are in really dramatic need to whom the donations of food and other things would also very much be appreciated. We're working on processes with HHS to do home delivery of meals to our elderly population and to our vulnerable populations as well. And so we're looking at those programming, and so support from the public helps us get to that faster.
Appreciate that. The Bethesda Central Farm Market, I appreciate the guidance that we've gotten on the farmers markets, the fact that they have stepped up to add in additional protocols to keep people safer, but they're keeping them open. I think that they're safer than grocery stores because they're out in the open and more spread out in that sense. So I appreciate that fact as well. And the comment about the parks with the additional 600 signs that are going up. I've been working closely with Parking Planning Commission on that. And I think it just raises the broader point that the Parks Department and the county can't enforce all the things that we want people to do. And so we need our residents to take personal responsibility for themselves, for their families, for their neighbors, and make sure that we're doing what's going to keep all of us safe, what's going to get our economy back on track, what's going to allow us to return back to normal, which is everybody following the guidance of you all doing the great work that you're doing. So thank you. I really appreciate it. We're all in this together, and we're going to get through it together, and just want to thank you again for all your leadership.
Thank you. Vice President Hucker.
Thank you. Can you hear me okay?
Yes, we can.
Okay. Thank you, Mr. President. I thank you all for this helpful briefing. I'd prefer to be with you in person. And let me echo the comments my colleagues have made, Dr. Gale and Dr. Stoddard, about all your leadership on this. It's really, I think, not just for us, but for all of our all the members of our public. Really, confidence building and comforting when we get such such poor leadership from the White House. I got just as Andrew did, I have a long list, and I'll probably send you some by email, but a couple that have come up more than once I want to refer to you. One is our emergency alert system. Has that been used to communicate about COVID, or is it being reserved for urgent messages in the future?
Yeah, we had a conversation about this yesterday. So the days are running together at this point.
Yeah, right.
Yes. We had a conversation about this. Dr. Gales and I absolutely agree that we need to utilize the alert system, but we want to reserve it for actions. And so distinguishing between our public information system and public warning system, which is the alert system, we want to make sure that we're focusing on specific actions that we need the public to take in a time-sensitive manner. But I will say we both agree that the alert system is something we should be utilizing more than we are now. We just got to figure out the right delivery mechanism or right occasions to use it strategically. And so we agree. We plan to do it more in the future. We just want to make sure we have the right time frame to do it.
Great. Very helpful. I thought that might be your answer. Okay. Councilmember Glass asked about the homeless population, but in general, and I know this is probably also a call for question for Dr. Crowell and others that aren't there, but could you comment at all or elaborate on the county's preparations for a surge in requests for additional safety net services? I've been in touch with some food relief providers. I'm aware of some of their needs, but I'm worried about what's happening with school nurses, for example, that we were already short-staffed, social workers and other HHS staff that aren't in their buildings or are on the job the way they normally would be. Oh, and also if we're experiencing absenteeism in HHS, the way that has very much affected Metro and other agencies. Thank you.
I will address the staffing piece. So for folks who have maybe had their services curtailed due to closures, we have had pretty aggressive and proactive measures in place to address reassigning them to other places. So, for example, our school nurses and health techs have been repurposed in a number of ways. We've got some of our nurses in our call center, staffing and helping conduct contact investigations. We have some that will be working with corrections to do temperature checks for employees there to help assist in that area. So we've looked at the need for services across the board, not just within public health and HHS, but also across county agencies to look for opportunities to repurpose folks to utilize and maximize their skill sets.
Okay, thank you. You mentioned the call center. We've struggled to staff that even under great circumstances. Has that been a problem with absenteeism, and is there any additional support we need to be providing to make sure that that's staffed up?
I think the call center is actually fairly well staffed at this point. We have over 30 folks working in the call center at any given time, or at least from 8 to 8, and then overnight we have multiple people who are on call to be able to answer clinical questions that pop up from 311 that aren't easily just explained by frequently asked questions or redirection. And that I know we do still have to work on some logistical things around language and issues like that. But for the purposes of being able to get in information, that has been fully operational from 8 to 8 for over the last week.
I would only add that for 311, in total for all issues, they took roughly 11,000 calls last week. About 15% of those were related to COVID, so 1,700 total calls for COVID, which obviously means that 85% of the rest of their calls are still about the services we deliver related to, maybe impacted by COVID closures. But they have seen an uptick in calls, but not an insurmountable uptick in calls. Many of those calls are actually testing-related calls going over to disease control ultimately, but that's the numbers.
Okay, very helpful. Thanks. I'll send you the remaining ones by email. Very much appreciated. Thanks, Mr. President.
Thank you. And the last person to speak is going to be Councilmember Jawando, and he's saying it's short, so we're going to make certain, we'll see what short means to him. Thanks, Councilman.
Man of my word, so thank you. I'm glad Councilmember Friedson brought up the faith community. I have heard similar requests, and also in the Governor Hogan issued a letter. We were able to get some guidance that if you're helping food agencies like Capital Oil Food Bank or MANA, you are considered essential, and you can partner with those organizations. Their partners are given that authority as well. So that's another, in addition to blood drives. I just wanted to bring up the hoarding issue. For the millions watching at home, do not hoard. The governor issued a protective order yesterday, and Attorney General Frost has been now aggressively trying to go after folks who are doing this. I just want people to know that it's $10,000 per incident of hoarding. And so if you do 10 different items, it's $100,000, and it's really not fair. And I've seen it hoarding. And I'm sorry, I should be saying price gouging is what I really mean to say, but which is usually the other side of the coin. I'm talking about price gouging, and which is related to hoarding. And so we've seen that. We have an Office of Consumer Protection here in the county. You all can speak to this if you have anything to say, but I just wanted to make sure that people know that is not helpful. And people need to access things at the grocery store and other things. And if there's anything that we're doing to emphasize that, where people can go to if they see a price gouging incident, you know, a water or chicken or something that shouldn't be the price, where they report it. I wanted to bring that up and offer you the opportunity.
Yeah, so absolutely price gouging report to our Office of Consumer Protection. We're working with the AG's office to follow up on those issues when they arise. I mean, hoarding is also an issue. You mentioned that, you know, indirectly, but also as well. But the other thing I really want to bring up too is scams. We are facing even that at the county government level with our acquisition of PPE. You know, whenever there's price gouging and hoarding, the scammers see an opportunity to step in and take advantage of people too. And so all three of those things are things you should report to our Office of Consumer Protection. They are operating remotely. They're still activated. They're still teleworking, but they are taking complaints and launching investigations based on those reports. And so I would certainly encourage that to happen as well. But the scamming is affecting the state. It is affecting the locals. It is affecting our nonprofits. People thinking that they're offering up PPE that they don't have and getting people to pay for things that they can't deliver on. And so it's just really, really important that, you know, as people get desperate, certainly in all, you know, clinical environments and other places where they're trying to get PPE, these scammers they're taking advantage of people and, you know, in desperate times. And so certainly just have people be on the lookout for that. It's really important.
Thank you very much. I last week did a video with Director of Consumer Affairs Eric Friedman on scams, and we mentioned during that people that do scams during normal times are disgusting. When the fact that they're doing them now takes it to a whole new level. Thank you, gentlemen, very, very much for being here. We appreciate you each and every day, perhaps every hour of each and every day. In fact, I will say every hour of each and every day, and not just you, but everyone that's doing all this very necessary work. Thank you.